Serotonin is a key hormone that stabilizes our mood, feelings of well-being, and happiness. This hormone impacts your entire body. It enables brain cells and other nervous system cells to communicate with each other. Serotonin also helps with sleeping, eating, and digestion. Your body uses serotonin in many ways. Serotonin in the brain is thought to regulate mood, happiness, and anxiety. Low levels of serotonin are linked to depression, while increased levels may decrease arousal. Serotonin is found in the stomach and the intestines. It helps to control your bowel movements and function. Serotonin is produced when you become nauseated. The production of serotonin increases to help remove bad food and other substances from the body. It also increases in the blood, which stimulates the part of the brain that controls nausea. Serotonin is responsible for stimulating the parts of the brain that control sleep and waking. Whether you sleep or wake depends on the area that's stimulated and which serotonin receptor is used. Serotonin is released to help heal wounds. Serotonin triggers tiny arteries to narrow, which helps to form blood clots. Having very high levels of serotonin in the bones can lead to osteoporosis, which makes the bones become weaker. Serotonin helps to regulate your mood. When your serotonin levels are normal, you should feel more focused, emotionally stable, happier, and calmer. Low levels of serotonin are often associated with many behavioral and emotional disorders. Studies have shown that low levels of serotonin can lead to depression, anxiety, suicidal behavior, and obsessive-compulsive disorder. Serotonin syndrome can occur when you take medications that increase serotonin, leading to side effects. Too much serotonin can cause mild symptoms such as shivering, heavy sweating, confusion, restlessness, headaches, high blood pressure, twitching muscles, and diarrhea. More severe symptoms include high fever, unconsciousness, seizure, irregular heartbeat. Serotonin syndrome can happen to anyone, but some people may be at a higher risk. You're at a much higher risk if you increase the dose of your medication that's known to raise serotonin levels, or if you take more than one drug known to increase serotonin. To increase serotonin levels, you should exercise regularly, improve your diet, get more light, try massage therapy, and use certain supplements. There's many ways to increase the serotonin. The FDA has approved many SSRI medications, such as Celexa, Lexapro, Prozac, Paxil, and Zoloft. Other drugs, like LSD, interacts with the serotonin receptors. MDMA, known as ecstasy, causes a great release of serotonin and norepinephrine. Serotonin is what plays the important part in the regulation of mood, sleep, pain, and appetite, and the excess release of the serotonin by MDMA is likely what causes the mood-elevating effects that people experience. As you can see, there's many things that alter serotonin levels, yet they all have drastically different effects on your mood. Therefore, it's not as black and white as just saying that serotonin makes you feel good. Chocolate also increases the neurotransmitter serotonin through a key compound that can be isolated from the chocolate called tryptophan. Tryptophan is an amino acid found in small quantities in chocolate, and it's the precursor for serotonin. The body uses the tryptophan to make melatonin and serotonin. Melatonin helps to regulate the sleep-wake cycle, and the serotonin is thought to help regulate appetite, sleep, mood and pain. The liver can also use tryptophan to produce niacin, which is needed for energy metabolism and DNA production. Normally, people would supplement with 1 to 2 grams of L-tryptamine to induce sleep. Some of the most serious potential problems associated with chronic sleep deprivation are high blood pressure, diabetes, heart attack, heart failure, or stroke. Other potential problems include obesity, depression, impairment in immunity, and lower sex drive. Chronic sleep deprivation can even affect your appearance. You can check out my video on herbs to help sleep for more natural solutions. Getting enough sleep has many benefits. It can help you get sick less often, stay a healthy weight, lower your risk for serious health problems like diabetes and heart disease, reduce stress, improve your mood, allow you to think more clearly and do better at work. You get along better with people. You make good decisions and avoid injuries. For example, drowsy drivers cause thousands of car accidents every year. It's hypothesized that in individuals, melatonin, which is normally a product of serotonin, may be converted back into its precursor and thus replenish serotonin stores, showing the importance of the melatonin-serotonin sleep-wake balance. Low levels of serotonin in the brain elicit sugar cravings, while eating sugar improves mood and alleviates anxiety temporarily. This extra sugar consumption, though, leads to magnesium depletion, and it also increases the risk of many diseases, leading to conditions like weight gain, depression, autoimmune, and inflammatory diseases such as chronic fatigue. Therefore, it's important to ensure that you learn to manage your serotonin levels through supplementation, exercise, sleep, and other ways, rather than reaching for sugar. Drinking alcohol can temporarily boost serotonin levels, making you feel happier, but in the long term, excess alcohol can lower serotonin levels and therefore cause or exacerbate a depression. Serotonin synthesis, release and function in the brain is modulated by vitamin D, and the two fish oil extracts EPA and DHA. Brain serotonin is synthesized from tryptophan by the enzyme tryptophan hydroxylase, which is transcriptionally activated by vitamin D. So inadequate levels of vitamin D, which are found in 70% of the population, and lack of omega-3 fatty acids can interfere with serotonin brain synthesis. You want to make sure that you get a 25-hydroxy vitamin D blood test and then supplement accordingly with vitamin D3. Common doses of omega-3s are taking an EPA-DHA molecularly distilled fish oil blend at 3 to 9 grams per day. Vitamin C is also needed to convert tryptophan into serotonin in the brain. You want to take vitamin C in the form of liposomal vitamin C for the greatest absorption. You can Google how to cheaply make a liposomal vitamin C in an ultrasonic cleaner. The next best form of vitamin C would be a non-acidic vitamin C, and the worst kind would be a cheap acidic ascorbic acid. Research suggests that supplementing with magnesium can help to increase serotonin levels. In fact, low serotonin levels have been observed in people with a magnesium deficiency. You want to take magnesium in the form of magnesium bisglycinate. In order to determine your dose, slowly increase until side effects like diarrhea and stomach discomfort are noticed. Then gradually reduce your dose until you can determine your maximum daily tolerable amount of magnesium. As magnesium is required for the activation of hundreds of enzymes in the body, it can have profound benefits after a few months of supplementation. Like magnesium, with its effect on hundreds of enzymes, zinc is also required by around 100 enzymes. It was hypothesized that the antidepressant effect of zinc is dependent on serotonin transmission. Thus, a robust serotonin-enhancing mechanism may be influential in supporting zinc's therapeutic effect. Be sure to get the recommended 30 to 50 milligrams of zinc, but be aware that many forms have a low bioavailability, some as low as 20%, meaning you need a much higher dose to achieve the correct levels of zinc. The absorption of zinc, as well as vitamin C, is enhanced when it's taken with the flavonoid quercetin. This can be found in elderberry juice, for example. And quercetin is also effective in the modulation of serotonergic activity by attenuating mitochondrial MAOA activity in the brain. 5-HTP is naturally occurring in the seed pods of Griffiona, and it's used as a nootropic substance, which is a substance that can enhance cognitive function. Subsequently, nutritional intake of 5-HTP can provide a means for restoring serotonin to optimal levels. Your gut produces about 95% of the serotonin in your body, and changes in your serotonin level affect your gut as well as your brain. IBS, or irritable bowel syndrome, is a common condition that primarily affects the large intestine. Essentially, your gut is responsible for your daily mood. However, medical conditions like IBS and leaky gut syndrome can keep your serotonin levels low. They can cause inflammation throughout your body, and they can lead to medical conditions like brain fog, seasonal allergies, skin problems, and more. Some solutions for a leaky gut are to take enzymatically preserved colostrum and the amino acid L-glutamine, and also the elimination of gluten and other suspected allergens from the diet. Considering probiotics in the gastrointestinal tract have been shown to affect levels of serotonin via the gut-brain axis, and changes in intestinal microbiota have been shown to improve sleep parameters in conditions like chronic fatigue syndrome, it's likely that probiotics can have an effect on your sleep, as well as your mood and your serotonin levels. The best probiotic that I know is called VSL3. Other ways to improve your microbiome are to get prebiotic fiber like inulin, and to eat fermented foods like sauerkraut, kimchi, kombucha, and kefir. Folic acid and B12 are involved in the synthesis of serotonin and other neurotransmitters. A B12 deficiency has been found in many patients who have depression or decreased attention, concentration, and memory. You want to take a high-quality multi-B with B12 in the form of methylcobalamin. You could also take a B12 methylcobalamin 5,000 microgram sublingual tablet as well. You should know that a B12 blood test can fail to detect a deficiency due to food now being fortified with folate, and this throwing off the reading of the test. You can also take a separate folic acid supplement, but be sure that it's in the form of L5-methyl tetrahydrofolate. L-methylfolate is the only form of folic acid that crosses the blood-brain barrier, and it plays a role in neurotransmitter synthesis. It indirectly facilitates the synthesis of serotonin, dopamine, and norepinephrine, which are the three neurotransmitters involved in mood regulation and other important functions. You may be particularly low in these B vitamins if you have the MTHFR variation in your DNA. This can disrupt your folic acid cycle, leading to increases in the damaging byproduct homocysteine and affecting cortisol stress hormone, leading to all sorts of conditions like depression and chronic fatigue. But this can be easily controlled with extra supplementation. In my other videos on mental health conditions, I go into detail about methylation, homocysteine, and folic acid cycle. Ginseng is an adaptogenic herb. Adaptogens are herbs that are said to have a balancing effect on all systems in the body. A study showed significant antidepressant effects in different depression models and significantly increased hippocampal serotonin levels. And it concluded that the increase in the serotonin may be another mechanism by which the ginseng ingredients exert their antidepressant effects. When purchasing Panax ginseng, only purchase the roots, as ginseng has a reputation of having the most adulterated fake tablets on the market due to its high value and high demand. Ashwagandha is another adaptogenic herb from India. In studies, there were changes in serotonin levels before and after treatment noticed. There was an increase in cortico-hippocampal serotonin when compared to the untreated subjects in the trial. One study found that bergamot, lavender, and lemon essential oil are particularly therapeutic to promote your brain to release serotonin and dopamine. You can check out my other video on consuming lavender extract, which is called Forget Valium and Prozac, Try This Herb Instead, for more information on the dose and the effect of ingesting lavender. L-theanine is extracted from green tea. It's historically been reported as a relaxing agent, prompting the scientific research on its pharmacology. And neurochemistry studies suggest that the L-theanine increases serotonin, dopamine, and GABA in the brain. In a review, scientists found evidence, particularly from results in animal studies, to support the hypothesis that the thyroid status impacts the serotonin system in the adult brain, and that increasing thyroid hormone levels increases serotonin neurotransmission. You can see my other videos on hypo and hyperthyroid to get an understanding of your thyroid function to determine if this may be a contributing factor to a serotonin imbalance that you may be experiencing. Results from a study suggest that CoQ10 deficiency affects serotonin in the platelets and presumably in other cells like the neurons in the central nervous system. Many diseases are linked to deficiencies in CoQ10. The best form to supplement with is ubiquinol in doses ranging from 200 to 400 milligrams per day. Evidence suggests that insulin activity plays a role in serotonergic activity by increasing the influx of tryptophan in the brain. Supplements that can help with blood sugar levels and insulin sensitivity include alpha-lipoic acid, berberine hydrochloride, cinnamon, chromium, and vanadium. You can check out my other videos on type 2 diabetes for ways to help to improve your insulin sensitivity and your blood sugar levels. Curcumin is extracted from turmeric root. When the brain's neurotransmitter levels were checked following curcumin administration, it increased the levels of serotonin and dopamine, but not norepinephrine, in mouses' brains. Further, curcumin potentiated the brain levels of serotonin when it was combined with various other antidepressant agents. Doses of curcumin can range from 2 to 4 grams per day, but due to its low bioavailability, its absorption needs to be enhanced by taking it with biopterin, which is a black pepper extract, or with fish oil, butter, ghee, or coconut oil. There's a lot of mental health problems associated with low levels of serotonin. It seems unlikely that your serotonin levels would become too high unless you're taking prescription SSRI drugs in combination with other drugs or supplements. The risks from SSRI drugs far outweigh the benefits, as they can interfere with sleep, and this can lead to a host of other physical and psychological problems. Long-term use of SSRIs can trigger manic depression and lead to a lifetime of severe mental health consequences and medication. Through dietary changes as well as supplementation, it's not only possible, but it's scientifically proven that serotonin levels can be balanced naturally without any of the associated side effects of these prescription drugs. Apart from SSRIs, one of the worst things you can do is have a high carbohydrate diet, as this depletes the body of the necessary micronutrients required for the normal synthesis of serotonin. Problems with the folic acid cycle and its need for extra B vitamins due to something like an MTHFR variation may be another contributing factor. Although there's numerous herbs that can help boost serotonin, these would only be recommended for short-term use. The safest and healthiest way to attain and maintain optimal health in relation to serotonin levels would be to correct any deficiencies, provide the diet with the necessary precursors so that your body can make its own serotonin, and ensure that you get sufficient sleep and exercise. Also be sure to fix any digestive issues, allergy, food sensitivity, and boost your prebiotic and probiotic levels in the body. You can check out all my other videos on specific mental health conditions like OCD, panic attacks, anxiety, schizophrenia, and bipolar disorder for more related information on neurotransmitters and mental health.